Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift. In our Expert on the Microphone series, today we're joined by the powerhouse husband-wife duo, Dr. Stephen Dayan and Dr. Sabrina Fabi. Dr. Dayan is a facial plastic surgeon, clinical assistant professor, researcher, and best-selling author with top doc recognition by numerous organizations. Dr. Fabi is a renowned board-certified dermatologist ranking in the top 5 of Newsweek's 2023 list of America's best cosmetic dermatologists. She's also an associate research director, has authored over 210 publications and lectures across the world on aesthetic dermatology advancements. They're quite the impressive pair. Together, they're going to join me to discuss their latest venture on XOMD Skincare, the first mood-ceutical skincare line. They're here to discuss the mind-skin connection and break down the most exciting technologies and advancements in the aesthetic industry today. Welcome to the show, superstars.
Hi, Zen. How are you? Nice to see you.
So we're going to dive right in. Studies show a strong link between the mind, emotions, and overall skin health. For example, stress hormones like cortisol worsen dryness, wrinkles, and acne. And on the other hand, as a plastic surgeon, you offer aesthetic procedures which can not only transform your patient's appearance, but also how they feel. Now, after an aesthetic procedure, a patient's confidence has the ability to lower inflammation in the body by decreasing those cortisol levels and in turn, decreasing the inflammatory process. Now, Dr. Dayan, I know this is your area of expertise. Tell me, what inspired you to explore the psychosocial dermal axis? And can you tell us more about the transformative effects of understanding that mind-skin connection?
That's a great question. And it's really been mine and Sabrina's North Star as we developed this mood ceutical, because we've always recognized that when we're in the clinic, you can give a person a perfect outcome. You can make them physically beautiful, but they may not be satisfied. They may not be completely happy. So what else is it? And early on in my career, I realized there's something more to beauty, and that's the ability to feel beautiful, which is more important than looking beautiful. And as we move forward in creating a skincare product line, we wanted to make sure we were addressing that component.
It's very symbiotic, this relationship that not only that you have between the mind-body connection, but between the two of you. So I'm going to pivot to Dr. Fabi. You and Dr. Dayan founded XOMD, which focuses on exactly what we're talking about and is the first mood-ceutical skincare line to hit the markets. And I read that the idea for XOMD first took shape when you were pregnant with your son, Mateo, trying to bottle up that pregnancy glow. I love this story. Can you tell us more about the science behind XOMD's mood-ceuticals and how oxytocin is at its core?
Well, oxytocin is actually, Zen, our number one antioxidant at the level of the skin. You really rely on oxytocin. This is the reason why when someone's pregnant, when someone's in love, you can see that they're glowing, that they look almost a little bit more youthful, that their skin looks a little bit more supple. People may comment, gosh, what are you doing? Or have you met someone, or are you in love? It's like that look of love. And I definitely noticed in my personal experience when I was pregnant, like I almost looked a little bit younger. And so that really made us both, explore this hormone that we naturally secrete and to see, why hasn't anyone come up with something like this? Now, historically, you could get it from a drug, but can there be something topically that we can apply through botanical extracts like jasmine that can naturally make this product be excreted in our skin? And we were able to formulate something that in a double-blinded placebo-controlled trial was able to prove that it could be done.
What people don't realize, and even doctors don't realize that, is that your skin communicates with your environment, and your skin and your brain have this access that goes back and forth, all at a subconscious level. Oxytocin is very unique because when it goes up in your skin, when you hug someone, when you cuddle someone, when a mother and baby bond, the oxytocin levels go up in the skin, but then it causes a positive biofeedback loop with your brain, and your brain then releases more oxytocin. Your plasma levels go up of oxytocin, and overall you get this euphoria. You feel better, and we capture that in a bottle.
And I understand that these products are clinically proven, and you conducted these double-blind, placebo-controlled, randomized crossover trials that you just mentioned to further validate their effectiveness. So I love that things are clinically verified in research. Now, Dr. Dayan, can you share some of the key findings from the trial and explain why it's so important to offer products that are not only dermatologist developed, but also backed by rigorous clinical research?
Many doctors have skincare lines, but very few actually formulate their own and then study it and test it to such rigorous standards. And I believe that that's really something we should all do. And that was something we had to do in order to put our name on it. So we did that strict trial. And afterwards, what did we find out? Well, it was really interesting because we showed improvement in skin quality. And we can prove that in things like radiance, dewiness, better hydration, less redness, more skin tone evenness. And that was against placebo, which had no improvement. We also looked at confidence. Confidence went up 60% at 4 weeks, 86% improvement in confidence at 8 weeks. Then we looked at things like first impressions. If you wear this product, you project a better first impression. And things such as people look more attractive. They look more financially successful. They look 3 years younger. And then the last thing we looked at, we put a pheromone type product in there. So I'm like, Sabrina, let's measure sexual satisfaction. She's like, no, we can't do that. I'm like, please, let's measure sexual satisfaction. So we put in a validated scale, which is a very rigorous benchmark. And what we find, yes, people who were in our clinical trial, statistically significant improvement in sexual satisfaction, 18 out of 20 categories. Placebo, zero. That was so
Wow.
profound. We went back to the statistician, like, are you sure you didn't make a mistake? Because we both do clinical trials to see data that's so different between placebo. We're like, we got
Because we
something.
always have a placebo effect, but in this particular case, there was zero.
Wow, this is so impressive. Look at you, little dynamic duo over there changing the face of clinical research. I love this. Now, many people use skincare as a self-care ritual. So I love how not only are these moodceuticals scientifically built to improve your mood, but the very act of using them is transformative in and of itself, right? So I'll also bring up another clinically proven product, CO2 Lift, which I
Yes.
know you are both familiar with. It's a non-invasive medical grade carboxy gel mask that offers both monotherapy and combo therapy benefits similar to XOMD products. The CO2 Lift mask improves texture, tone, and helps reverse the skin's aging process. Dr. Fabi, as a renowned cosmetic derm at the top of your field, how do you see the CO2 Lift mask revolutionizing skincare, and how can it complement the science behind moodceuticals and the mind-skin connection?
Well, in fact, I do a lot of laser resurfacing as a dermatologist living in Southern California. So this is the only way really sometimes to get rid of all those pesky lines and wrinkles, like the deep setted lines and wrinkles. But a limitation with something that's so effective is that there's so much downtime. And the wonderful thing about CO2 Lift that I actually took from Steven is that it's able to reduce that downtime so that it gets patients back out there and more confident because they were actually able to embark on the treatment that was going to give them the best result. And so you did the clinical trial. Maybe you want to share that.
Yeah, I did clinical trials in this. And I think this is an old science that the CO2 lift has found a way to harness it and allow us to use it in the topical mask. CO2, when your carbon dioxide levels go up, it actually causes what's called a Bohr effect. And a Bohr effect means the hemoglobin, your blood cells, are more attracted to the carbon dioxide. It picks up the carbon dioxide and it drops off oxygen in your tissues. So it increases oxygen in your tissues. When you increase oxygen in your tissues, you get more angiogenesis or more blood vessels. You get better flow of blood vessels, greater density of these vessels. And then you start to get improvement. Growth factors are released. And you also get better proteoglycans. So in other words, the building blocks of your skin get reproduced and regenerated. So all these wonderful things happen, and it's nothing new. In the 1930s in France, people who had ulcers and they had open wounds would sit in carboxy baths filled with water. So of course, thank you to the French again to give us some great idea that we now have in CO2 Lift that we can put onto our patients topically, and they can wear it before and after undergoing procedures.
Now we're going to talk a little bit more about this clinical trial. So 87% of XOMD users found the opposite sex more attracted, and 90% reported greater sexual satisfaction. You alluded to this earlier, but not to mention in 2 cases, users conceived while using it. Is this accurate?
Okay, so I've been doing
I'm reading these stats and I'm
wait,
like,
Zen, we're not going to finish there because we got an anecdote on this on panning. We've been doing studies for years, and I do many studies. I've thousands of patients through clinical trials. I've never had it where 2 people dropped out of a study because they got pregnant
in 4 weeks.
And within 4 weeks, and they're supposed to be wearing double protection. So what is going on here? Now, we are surmising that it improved relationships because the men who were married or partnered with women who were in the study also reported greater sexual satisfaction. We don't talk about that much, but I got to tell you, for Valentine's Day, guys, ditch the flowers, get them XOMD, because you're going to have your sexual satisfaction goes up also. So we think there was greater intimacy, and we did interviews afterwards and they told us there was greater intimacy. And now since we've launched, we have
We
another
have
story.
another, yes, my assistant is now pregnant.
What line of work are you in?
So we're
Making
not saying
babies?
that, we just think it improves intimate relationships between people.
I
Really?
love it. And,
I got to tell you, look,
I'm sure it differs from couple to couple because studies have shown sex to be beneficial to our health. It lowers blood pressure, boosts the immune system, improves sleep, even decreases depression and anxiety. So I'm going to tie this back to CO2 Lift. They also
Yes.
have a vulva rejuvenation
yes,
product called the CO2 Lift V, and the founder, Londa Kerr, is a huge advocate for sexual health. The importance of intimacy. Dr. Dayan, let's chat this. I know you authored the book Subliminally Exposed, which details the how and why behind our actions when it comes to mating, dating, and communicating. And you often speak about attraction and maintaining intimacy. So, given your expertise, how do you see intimacy playing a role in overall well being? And how do products like XOMD's Moodceuticals and CO2 Lift V contribute to enhancing both that desire and connection between partners? I mean, I know it got people feeling sexier, but what's really at the heart of it all?
these are great questions. And, for many years, this was somewhat taboo, especially in our professional medical field. But the reality is that sex is good for us.
It's great for us.
It releases endorphins. It brings us closer together. When these oxytocin levels go up, you feel better about yourself, but you also feel closer to your partner. You stand closer. There's greater fidelity. It's better for the offspring. We're really at some core level, we're animalistic, and we can't help it. We have primal urges, and while we can fight them, they're there. And I think we have to accept those primal urges. And when we recognize that when we're attracted to someone, there's something so much more that's going on than just the way they look. We're physically attracted to them, and exploring that and developing. And of course, it has to be healthy, but it's really good for you overall. Now, both XOMD and CO2 Lift are opening up and pioneering this field from our aesthetic world. There's a whole sexual health and wellness world, but we're not generally part of it. But now together we're merging, and things like CO2 Lift and us are saying, hey, wait a second. Beauty, aesthetics, sexual health, they all kind of interrelate. Where is that connection? And that's what we're finding with these products right now.
Because sex ultimately allows you to feel good, right? And so for a woman, that vulva region, as we age, you can have more pain with intercourse. You may not be as comfortable. You may then start disengaging, which ultimately has an effect, not just in the pleasure of that moment, but also just how you conduct yourself with that relationship day to day. And so if you're able to improve the vulvar area and rejuvenate it to a certain degree, you enjoy intercourse more frequently. You are closer to your partner because of the oxytocin that you're able to release during that intimacy. And that just ends up, if you end up feeling good, you end up looking good. Where historically in aesthetics, we focus more on looking good and that resulting in feeling good. But I think that through your work, that's ultimately what you talked about in your book too, right? It's those that sometimes have that inner feel good that actually look good. And then they may not need the products that we do every single day in our practice to necessarily help them look even better.
And these are such easy at-home modalities that you can be proactive with your life about. And I love that you guys are at the forefront of sexual wellness and demystifying the stigmas that surround both women and men, because these products are used both on women and men. So I love that. So lastly, we're out of time. I could talk to you all day about this. But you have a conference to get to. I'd love to get both your perspectives, not just as top practicing professionals in your field, but also as educators. Why do you believe education is crucial in the aesthetic industry, not only for students and fellow professionals like yourselves, but also for your patients?
Breaks down barriers, defeats prejudice, and it makes us all better for our patients. Ultimately, at the end of the day, that's our job. We pass it on. We're just a vehicle, a vessel that takes knowledge from those before us and passes it on to those after us. And it's really a privilege to have people who learn from us. And Sabrina and I have been teaching. We've published over 400 articles. We've been to conferences all around the world, and it's a passion for us. And I think, when they rise, we all rise.
I think education is extremely important because it empowers people about what's possible, about what they can do based on things that our ancestors have studied. And then it also gives us a vehicle in which we can better and advance medicine so that you're empowered through it all, right? I think it's important now more than ever because a lot of people claim to be experts and maybe they haven't done, 4 years of undergrad, 4 years of medical school, and then 5 years of residency training. So it's important to disseminate this information, because some of this work, it's reinventing. Some people are trying to reinvent the wheel with education that's already been established, has already been studied, and it's already been out there. So disseminating that is extremely important, just as much as the education itself.
I can't thank both of you enough for coming on. I mean, this has been such an inspiring, very transparent, and very informational session. I love having the two of you on. You guys are not just amazing as a couple, husband and wife, but just incredible professionals.
Thank you so much, Zen. Great to be with you.
And we got to get you some XOMD.
That was our Going Deep segment, brought to you by CO2 Lift. And that was the incredible powerhouse husband-wife duo, facial plastic surgeon, Dr. Stephen Dayan, and board-certified dermatologist, Dr. Sabrina Fabi. Definitely check out their mood-ceutical skincare line at XOMDskin.com. And you can check them out on the gram at XOMDskin. And you can stay up to date with Dr. Dayan at Dr. Stephen Dayan, spelled Dayan, and Dr. Fabi at Sabrina.Fabi, Fabi. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.